we are now going to address a subject that I say is very interesting for so many people out there. Dr. Vivek Eranki, how are you this afternoon?
Very well, thank you, Richard. Thank you for having me back on.
Pleasure. Now, you're the founder and CEO of Cosmetique, so you're the country's largest network of cosmetic injectable clinics, and you've got one right here in North Adelaide, haven't you?
Right, well, one of the largest, yes. We are in North Adelaide, that's correct, on Melbourne Street.
And, you know, you want to talk about Botox today, or male Botox, and it's Brotox. I thought somebody had made that up when I received the notes about this.
Yeah. Well, Botox is what it's colloquially called as, but it's becoming more and more common, actually. Traditionally, Botox was typically, and same with fillers, typically in the realm of women in their 40s and 50s trying to reverse aging and volume loss. But more and more, it's becoming common among younger people and in men as well. So funnily enough, in Australia, it's actually the uptake of Botox and fillers is a lot more than in other countries. So in America, for example, the average age among men to get Botox done is in their 30s. But in Australia, we're finding that Botox and fillers are getting done in men in their mid to late 20s.
I mean, the first question that comes to mind for me is why would kids in their 12, because I'm a bit older, why would kids in their 20s get this done?
Yeah, that's a good question, actually, and I completely understand where you're coming from. I'm in my late 30s myself, and I look at young kids nowadays, and kids nowadays are exposed to different variables than people of our age. So if you look at what's happening nowadays, a lot of content that is that they absorb is through social media.
Yeah.
So the average person in their 20s spends about an hour a day on TikTok, for example, and they open it 8 times a day. They see a lot of their role models and celebrities getting injectables done, and it's openly discussed as well. So, for example, if you look at somebody like Tom Cruise, he looks a lot younger now than when he did back in the day.
And he's just turned 60.
Correct. He's almost 60 years old, and I was watching the new what's it called?
Top Gun. Yeah,
Top Gun, and he looks a lot younger there compared to some of his earlier movies. And as well as what this does is it basically removes the stigma around cosmetic injectables, and it removes the stigma around getting Botox done. And a lot of the men, they find that their girlfriends or their partners are getting Botox and fillers done as well. So that further reduces the stigma. And as soon as their friends start getting it done, that pretty much normalizes it. But what they get done is different to what their girlfriends or their partners get done. So typically males get their forehead, their frown, and the crow's feet done, but we are finding that more and more men are getting their chin and jaw done as well with fillers.
Hold on. When you say fillers in their chin and jaw, what does it do?
Yeah, so fillers were traditionally came about to replenish volume loss, and they go hand in hand with Botox. But what we are finding is more and more men are getting structural or heavier fillers done in their jaw and their chin to define it better. So in the olden days, people aimed to pretty much get rid of their double chin. Right. But now the aim is shifting more towards A, getting rid of their double chin, but B, also having a very broad lower face, as well as a very defined jawline and a defined and chiseled chin. And that's pretty much what fillers do. And the reason why it's becoming more popular is because essentially the structural fillers can last between 18 to 24 months. So once they get it done, they pretty much don't need to worry about that for the next couple of years. And the whole treatment takes about 15 to 20 minutes, depending on how much they want to get done. So they are finding that they can get it done. They can have it done in their lunch break, for example.
And do you notice a difference straight away? Let's say on the chin filler. So, somebody goes out in the morning, comes back and goes, my God, what happened to your chin? Yeah, it looks great.
Well, yeah, give or take. So what happens is straight after the treatment, there is a slight degree of swelling that happens, as well as bruising that happens. And this typically results in the first few hours afterwards. And yeah, the results are instantaneous. And that's one of the drawing cards of Botox and fillers among younger people as well. Because of social media, there is more and more of a culture of instant gratification. They see something, they must have it now. And if you look at all the commerce that's happening, that's pretty much the direction where everything is going. I mean, in the olden days, you order something and you wait for it to come in. Now you order it on Amazon on your phone.
Yeah.
And if you don't get it within a few days, you start getting a bit angsty about it. This is compounded by the fact that we are approaching the Christmas season as well. So there's a lot of Christmas parties. There's a lot of events where there's going to be cameras. And that's the reason why people are wanting to get treatments done in order to look optimized for these events. You need to remember that in the last couple of years, there's been lockdowns, there's been mask mandates, people have been through a lot. So this is the first Christmas that most people have in the last few years where they can really be normal again.
And I mean, we talk about, Botox for smoothing out wrinkles, getting rid of lines, but you've got notes I'm reading here, brow lifts. What are brow lifts?
Yeah. So and this is more common among women actually, but what happens is when you inject Botox into certain parts of the body, it pretty much reduces the action of some antagonizing muscle. So when you do that underneath the brow, it pretty much lifts the brow and it gives you a few millimeters lift. The whole thing can be done by 1 or 2 tiny injections on either side. And that's, again, very popular because what it does is it opens up the space around the eyes, making you look more refreshed. Traditionally, Botox was used in the forehead, the frown, and the crow's feet, but more and more people are using it in other parts of the face. I think last time I was on, we spoke about Botox being injected into the masseter muscle to reduce grinding of your teeth.
That's right,
but
yes.
Now that we are approaching summer, more and more people are having it injected into the armpits because it stops you from sweating as well. It's called hyperhidrosis, when you sweat excessively. And rather than being conscious about it, people are getting Botox in their armpits, which then reduces sweating. So there's a lot of uses for Botox, depending on the season and depending on what is popular amongst their friends and on social media, these uses come to fruition.
Can we just go back a bit? The grinding in the teeth, how did that work again?
Yeah, so what happens is when we inject Botox into the masseter muscles, it reduces the action of the masseter muscle. And when that happens, we don't grind our teeth as much, and especially at night and especially during the day. And we found that people were grinding their teeth more and more back in 2019, 2020, and 2021 because of a lot of the stresses involved with COVID. And this is a treatment that pretty much takes about 15, 20 minutes, and it lasts about 3 months. And what it does is it prevents a lot of other issues from happening down the line. So a lot of dentists have reported that grinding of teeth increases the risk of damage to teeth, which means that they need to get crowns done.
Yep.
A lot of people have also reported that spasming of the masseter muscles leads to issues such as tension headaches, which have since been alleviated after they got treatment to their masseter muscles.
I just want to emphasize that again because I just thought it was incredible. So Botox lasts for how? If you get it done, how long does it last for?
It lasts 3 months, and fillers last anywhere from, depending on which one, 6 months up to 2 to 3 years.
And does it hurt?
There's a tiny needle involved. It is the smallest needle that's available, so you feel a bit of a pinprick, but it is extremely well tolerated. With fillers especially, we also give numbing on top as well, so people, after the numbing done, people don't feel anything. But yeah, very minimal pain, very well tolerated. Funnily enough, we actually find that women actually tolerate the needles way better than men.
I'd understand that. That's fine. That's nothing wrong with that at all. And it doesn't, if you have it done, you're not off work for a day or anything, are you?
That's right. So we're finding that more and more people are actually wanting to get injectable treatments done or minimally invasive treatments done compared to surgical treatments, because when you get surgical treatments done, you are off work for a couple of weeks or a few days, and when you go back to work, you do have a lot of the bruising, the swelling associated with the surgery. With the injectable treatments, you can have it done within about 15, 20 minutes. You're going to be swollen for a few hours afterwards, but most people don't notice it, and you can get back to life as normal. So there is minimal disruption to you on a day-to-day basis.
Because you don't really want to go back to work and some people go, my God, what's happened to you? That's not going to happen, is it?
That's right. And also remember that when you have surgery done, when you go back to work, there's people noticing that you've had work done, but there's also the fact that there's a lot of things you can't do because once you have had surgery, there are restrictions that are placed on you for a good few weeks afterwards so that you don't injure yourself in the area which had the operation. So with injectable treatments, you sort of escape all of those post-operative recovery. I mean, there are things that you are not allowed to do after injectable treatment, so we recommend patients don't drink copious amounts of alcohol because that can lead to increased amounts of bruising. We recommend that patients don't go for facial massages simply because that could disrupt the work that's been done there. But the restrictions are minimal. I mean, most people just get back to work, get on their computer and start sending emails, and that can be done quite easily.
All right. Where can we find out more information, Vivek?
Yeah, absolutely. So our website carries a lot of information. So our website is cosmetiques, COSMETIQUE.AU. There's no .com. Or give us a call. Our phone number is 1300-320-272.
Thanks very much for joining us today. I just find it a fascinating subject. I've got a friend at the moment who gets Botox on a regular basis, and she always goes, it doesn't hurt, and I'm fine. I feel more confident about it. I just think it's not going away, and I think we've just got to probably have a look at it, and if you want to get it done, all the more power to you.
Exactly.
No worries. Vivek, enjoy the rest of your weekend.
Yes.
Thanks.
Have a great weekend.
Thank you. That was Dr. Vivek Eranki from the Cosmetic Clinics.